One of the points that I made in my talk is people carelessly say that, oh, it's because the Nigerian government isn't serious. But actually, the Nigerian government is very serious when it wants to be. So when the Nigerian government said we want to become self-sufficient in cement, and that's what we want to produce, did we not become self-sufficient in cement? When the Nigerian government said we're going to clean up the banking industry and we're going to go from, 200 banks to 60 banks in the space of a few years, did we not do that? When Nigerian government took pension reform seriously and said we want all working people in Nigeria to have pensions and to be enrolled on a pension plan, that happened overnight. When the Nigerian government wants to face something and face it wholeheartedly, we get very, very fast reforms. The problem is that the Nigerian government has not decided to face healthcare yet. And our role as healthcare advocates is to try and convince them that now is the time to face it. And the reason why I said now is the time to face it is because of the current problems in Nigeria right now: insecurity, unemployment, macroeconomic instability, and the fact that healthcare and investment in healthcare doesn't just solve the healthcare problem, but it also solves the problem of unemployment. We all know that the NHS in the UK is the biggest employer of skilled labour in the world. Retail stores give discounts to healthcare workers because they know that there are many and they like to spend. And that's because they're the people collecting salaries. If you look at almost every state in America, the biggest employers are healthcare and education. Nobody that has gainful employment will go and do kidnapping or banditry or Boko Haram or militancy. They will stay in the hospital or they'll stay in the primary healthcare center if they're getting a regular salary and do that rather than go and risk their lives in risky activities. So the main point of my talk today was to help stakeholders see healthcare as the solution to all, in quotes, Nigeria's problems, as opposed to just solving a healthcare problem.